webcast is titled Intro to Payor Enrollment with speaker Donna Goestenkors and Dina Solis. At the end of this session, we'll have time for a formal Q&A, but feel free to ask any questions as they come to mind via the chat box located on the right side of your screen. The symplr Education Series is sponsored by symplr, Compliance and Credentialing for Healthcare, formerly known as MedKinetics and Payor Enrollment Services. We are so pleased to have Donna Goestenkors as our speaker this month. Donna is a full-time healthcare consultant, speaker, author, educator, and mentor, serving the medical staff services industry for more than 39 years. I'm sure many of you know her already, and I'd like to turn it over to her now. Welcome, Donna.
Wonderful, thank you. Hi to all my webinar listeners. Today's one-hour introductory program is the first in a series of 3 targeting the topic payor enrollment. You know, when I work with clients and talk with colleagues from across the country, I've concluded one thing about this specialty area. There is definitely a lack, if not zero, resources and information about enrollment. Well, the buck stops here. At the end of this session, and specifically this program, you, the listener, will know exactly what enrollment is, how you can do it better, and how you can get involved to make it yet another career option for yourself. Your presenters today, Callie, it looks, there I am. Hi everyone, that's me, Donna Goestenkors. And my co-presenter is Dina Solis. Dina, would you like to give a shout out to our audience and just say a few things about your background?
Absolutely, Donna. Thank you. First and foremost, thank you, Donna, and thank you for asking me to help co-present with you today. It's very much a real honor. As a quick background, I met Donna a little over 3 years ago when I was starting my own business. Donna helped mentor me through that process and has been an invaluable asset to me ever since. I've read her books and follow her site and newsletters, and I just think can't say enough good about Donna. About me personally, I'm the sole proprietor of Sonoma Credentialing Services located in the San Francisco North Bay area. I'm in my 15th year of being in the credentialing and enrollment industry. Prior to starting my business, my background was with a large national DME and pharmacy provider where I handled their government and private payer contracting, enrollment, and credentialing. In early 2012, I left that company to start my own business and have been helping a wide variety of clients across the United States ever since. And I have to just add a little side note. I have to apologize for my voice here. I'm just getting over a nasty virus, so I apologize for the nasally sound of my voice, but I'll get through it. Hopefully in the next series I'll be much healthier. So with that, I will turn it back to Donna.
All right, wonderful. Next slide, please. As this slide demonstrates, all of these leaders are working together truly to make a difference. If I can direct you to the thought bubble at the bottom of that screen, that's the branding that I developed for MSPs, because in my 39 years experience, I have found that MSPs are never short on ideas and they're great problem solvers. So it's a result of your voice in the field that has identified that there has been a lack of information regarding enrollment. So the leaders in these organizations that you see before you, we have put together this webinar series. So this webinar with over 300 registrants today is our way of letting you know that we are here, we are listening, and we won't stop, because truly we want MSPs and we want to help develop them to be the very best that they can be. Next slide, please. So what are you going to learn in this introductory session? Number one, you will learn about the structure and framework of enrollment. And then Dina and I will give you a couple tips on what to avoid, as well as things that you'll want to incorporate into your practices. And please remember, at any time throughout this program, we are here to help you. So post your question in the dialog box, and as Amy had mentioned, we sure will get to as many of those questions as possible. Now, immediately post-program, look for the evaluation form. It will come to you electronically. And then within a week or certificate, which is compliments of our collaboration with the Texas Society for Medical Services Specialists. And you'll also receive an attendance certificate. Next slide, please. So really, let's get ready to learn. Those of you who aren't familiar with my speaking style, I always try to find some sort of messaging that will help really embrace the subject matter that we're going to tackle today. And I believe that each of you, everyone that is on this call today, you have powers that you never dreamed of. You can do things like enrollment that you never thought you could do. And really, there are no limitations in what you can do except the limitations of your own mind. And Dina and I are going to work over this next 50 minutes and really walk through with you about enrollment. So it will give you perhaps the pathway into a whole new career opportunity for yourself. Next slide, please. Next one. So, answers to your enrollment questions. It's interesting that when I'm in the field, there are 5 primary questions that I get consistently from my colleagues. Next slide, please. So it's really interesting as I go through these questions. I purposely wanted to include this slide to kind of provide to you a point of reference. They will come to me and say, gosh, Donna, you know, I hear a lot about enrollment. Is that something that I should be looking into? Should that be part of my career plan? Or I'll get statements like, oh gosh, you know, I'm just so unhappy. I just don't like what I do anymore. I'm kind of burned out on the verification aspect. Is there something else within our industry that I can kind of tip my toe in to see if I might enjoy that? A third question that I'll get a lot is, gosh, Don, I really feel like I have the verification or medical staff services department management kind of a really solid understanding of how those things work. Is there something new that I can introduce myself to by way of my professional development? Next one. Or they'll say, gosh, Donna, you know, I hear a lot about enrollment, and I even know some of my colleagues who are having to work with enrollment now. I mean, really, what's involved? What can you tell me about it? And then lastly, and if I do pursue enrollment, do I really have the skills that it takes in order to do them? Next slide. So before we start anything new, you know, we always need kind of to have a starting place, and it always starts with a plan, doesn't it? And I think the important thing to learn about enrollment is to truly understand, in my opinion, enrollment is part of the medical staff services industry. Many enrollment specialists have been kind of starving and asking for a place to belong. And I plan to embrace these enrollment specialists as an MSP colleague, as a partner in trying to improve the whole realm of medical staff services. And when you talk about embracing, we know that whenever we try something new, you know, there's going to be a change adjustment. You're going to have to learn new regulations, new practices, new strategies, a whole different direction. So just knowing that going into this phase of information gathering is important to know. Another aspect about getting started is to reach out to a mentor. Just as Dina had mentioned, we all need help, regardless of what level we're in. And if you want to learn more about enrollment, talk to a colleague who may be doing it, or talk to an insurance carrier and find out from their perspective how they manage these practitioners and this process. And then if it's something through your information gathering, it seems like something that you're wanting to do, you have to create a plan, right? And any plan requires you to take action. And I think that that's those are the tips in a nutshell about how we all get started with enrollment. Next slide, please. All right, now, for those of you who've been in the payer enrollment field for some time, you know that it's referenced in various different ways. It may be called payer enrollment. It might be called provider enrollment, or flat enrollment, or contracting, or credentialing. And when we're saying credentialing, and I know that this term is used in the industry, it's not the same type of credentialing that MSPs are doing in the verification component. And I just want to make that distinction. You may hear that being used by way of enrollment, but regardless of whatever in your geographical realm, regardless of what your organization refers to this as, there really is no right or wrong way. In a way, it's kind of like how I use in my professional development presentations about MSPs. Some people in the industry like to be referred to as an MSP, some medical staff services professionals, some medical services professionals. Right now, for the enrollment environment, it's all semantics. And Dina and I feel strongly about this, that it doesn't matter what it's referred to in your organization. The important thing is to be sure that you brand it, utilize that term consistently until you have a very good grasp of what it is you're doing and would have a greater influence in changing the title or the reference as you move forward. The next real component of enrollment in the introduction theme is, okay, Donna, what is enrollment? And to really keep that process and function as simple as possible, enrollment is the process of applying to a health insurance plan. So that provider or practitioner is included into that specific panel. And enrollment, next aspect, yes, allows the provider or that organization to really build that insurance plan for their services that they provide. So they, in a sense, are then getting paid for their services. And I think that those two components truly are the backbone of what enrollment is and why it's so important that we do this on a timely basis, because it matters to the dollars and to the practitioner who's and that organization who's expecting to get paid. All right, we kind of learned some of the foundational pieces of enrollment. Now I'd like to ask Dina, could you please help walk us through on the types of enrollment that exist?
Absolutely. Thank you, Donna. First of all, we have federal and state, which would be your Medicare, and state would be your Medicaid. In California, Medicaid is called Medi-Cal. TRICARE is also a federal type of enrollment for retired military personnel, and also current and retired military personnel. We have commercial and private insurances. These would be your Blues, Aetna, United Healthcare, Humana, Cigna, those types of carriers. In addition to, there are a lot of local area, regional type health plans included in the private and commercial area. There's also workers' compensation, which can include United States Department of Labor and, United States and state departments of labor and industries. And then also there are a variety of workers' comp MPNs, which stands for Medical Provider Network, there are a number of individual carriers and PPO networks that also participate in workers' compensation.
So Dina, before you go on, I'd like to use the analogy with regards to types of enrollment. It's kind of like the CMS regulations and whatever accrediting body your organization is bound to, and then your internal policies and procedures and bylaws. So although the names of these types of enrollments differ, the parallel is that we currently in medical staff services have various regulations and accrediting bodies that we need to be following as well.
Absolutely. So, know what types of enrollments we can do. We're moving on to how do we know who to enroll? Right now, you can look at the individual provider versus group provider enrollments, and this would depend on who the billing will be going through. So it would be an individual practitioner versus a group or an organizational tax ID number. That would need to be determined. If enrolling a group, the individual needs to also be enrolled for, excuse me, hang on one moment. I'm sorry, I just lost connection on my computer here. Okay, so sorry. If enrolling a group, the individual also needs to be enrolled so that benefits can be assigned to the group. Then you would identify your organization's internal enrollment processes before starting. A lot of times hospitals or groups or organizations might have their own processes that you would follow. And then you would identify the desired health plans to enroll in. And those could also be predetermined for you as well, just depending on your organization. Next slide, please. Another thing that you would need to know is how long it would take for the enrollment process. So processing timeframes, this is a tricky one because they vary by payer. So what I usually do is I contact the plan and ask. Some plans are very quick, 30 days, they can be 30 days or less, and some are longer. In my experiences, I'm familiar with Medi-Cal taking as long as 180 days, sometimes longer. And I just know this going into it, and it's helpful to be familiar so you can advise your providers ahead of time. And I'm also experienced with other states as well, but Texas comes to mind. I know that their process is a little bit longer than some as well. So it's always just good to contact the payer and ask. Next slide, please. So the enrollment process. Once you've identified who to enroll and into which plans, then you're ready to find out how. So what I usually do is I would contact the provider enrollment or provider relations area departments at each health plan. And how I would do that is I would refer to each payer's website for help. Sometimes payers have their processes right directly on their website, and sometimes you have to dig a little bit deeper. So what you would do is you would call and ask what their process is if you don't see it on their website. Ask whichever forms might be available, or if it's possible that it can be completed online, or if the insurance uses CAQH. You would ask if there are any special requirements, such as licensing. Sometimes payers require a special surety bond for different provider types. You would ask their processing time frame. And then I always ask what their preferred submission method is, if it's paper or if it can be online. If it's paper, I always ask for an overnight mailing address because I like to be able to track and expedite my deliveries to payers. And then also you want to ask if there's any key contact person that you could get, that you would submit it to, or if the submission goes to a general enrollment department, If possible, get that person's name, email, or fax number. I find that that's handy as well. Next slide. Some things that, that we have available to us for resources that can help manage our processes and help manage provider data, applications, CVO processes, expirables, reports, and communication are some credentialing software. Software can help automate the application process by auto-populating, tracking, and even submitting the applications. Obviously, we're aware of which MedKinetics, IntelliSoft, SciMed, Morrissey, Cactus. Next, please. Applications, well, actually, the software helps to auto-populate the applications, which is a huge time saver. It's a huge time saver. I found that software is very efficient in helping manage the entire overall process. Some plans have auto-fillable forms that you can download from their website, which is really helpful. It just helps minimize any, you don't want any hand printing on your applications. Credentialing software also helps, getting back to that, automate the process by populating, tracking, and even submitting the applications. For paper applications, if you're using those and your organization does not have Adobe Acrobat Pro, I would urge the organization to purchase that full version because that can also help as well with applications, for paper applications.
Dina, before you go on, a question about that second last bullet. The credentialing software can help automate and even submit applications. So can you walk through that just a little bit? So you use the software, you enter the information, and then you forward it to the insurance carrier?
Yes. Some software products will allow you to enter email addresses or fax numbers, so you can actually click a button to submit.
Okay.
This wouldn't work with all payers because every payer's submission method can be different. But it is, I've seen that can be an option, so that can be extremely helpful in streamlining the process as well.
Okay.
So next slide, please. So over the years, I've learned some resources. Obviously, CAQH is a huge resource, and with that comes some pros and cons to using CAQH. Some of the things that are great about CAQH is that it's online, obviously. The provider, either yourself or the provider, can enter their information and maintain it. Some health plans are able to download the provider's information without without having to actually fill out a paper application, which is great because that helps with delays and helps make the process quicker as long as the information is current. And some of the downsides about using an online system like that is that there is a little bit of, there's quite a lengthy application process that the provider has to fill out for you to be able, if you're entering the data for the provider. The provider's information does need to be reattested every 120 days, which you could do that for your provider or they can do it online. Documents, it can take some time. Each document usually needs to be uploaded separately, such as the DEA and the malpractice certificate and licenses and those types of things. Some other resources that I found have to be very helpful is called the Atlantic. It's a directory of health plans for 2015, and it's available through Atlantic Information Services. And what this is it's a comprehensive directory of all the United States health plans, and it includes member enrollment, plan type, demographic, and contact information. If we could advance to the bullet points, please. Thank you. What I've found is this is extremely helpful for organizations that don't quite know what health plans they want to enroll in. One of the questions that I get from my own personal clients in my business, they want to know what the top 10 health plans are for their area. And so I'm able, with this tool, I'm able to help the provider determine which health plans are largest, which health plans are in their area that are more geographic to their area. So I found this to be very helpful, and I just wanted to share it with the audience. And it's available in print, CD, a USB flash drive formats, and it's basically a database. And it's available on the website shown on the screen to purchase. And I have to say it is a little pricey, but it's extremely worth it. Another tip that I'd like to share is just these last 3 bullet points is to always take the time to accurately enter the provider's data on any applications, CAQH, or the software that you might be using, because that can be a number one delay as far as enrollments. Just any errors can definitely take away from the time that it takes to process an application. And then you always want to electronically save all of your work, and then uploading the provider's credentialing documents separately ahead of time. Sometimes I've had, when I say no bundle documents, just making sure that all your documents are clearly labeled when you save them, clearly named, clearly dated, maybe include the expiration date so you can keep track a little bit easier. And then always audit your work. I always go through and just make sure that I've gone through at least 2 or 3 times to make sure that my work is error-free. And I know that's kind of a no-brainer, but it's just a tip that I like to add in there.
Before you advance, Dina, another question, because this slide clearly depicts resources, and I see one listed. Now, you've provided us certainly some tips. In your experience in doing enrollment over these years, is there any other sort of resource that folks can refer to? Because oftentimes what I hear happening is that administrators will call the medical staff services professional into their office and say, hey, or even into the CVO, they'll go into the CVO and say, there's a new directive and you're now going to be responsible for enrollment. So how does an MSP who has no previous knowledge about enrollment, how do they know what to do?
Well, you could, I would say you could go online and maybe just try to connect with people who are in your industry. Like you mentioned before, I think talking to people who could possibly mentor you and give guidance. Mm-hmm. That's very helpful. I think that just basically calling a health plan and saying, hey, I've been assigned the task of provider enrollment. Can you please help me, walk me through what this process is with your particular health plan or state Medicaid or Medicare? That's very helpful as well.
Yeah, excellent. And what I've just described, that scenario, is happening in real life. So I think, again, the mentoring piece and picking up the phone and really asking folks who are currently doing the work, hey, can you help me?
Right, absolutely.
Okay, thank you.
Sure. Okay, I guess we can advance to the next slide. So one of the things that I wanted to talk about in dealing with provider relations departments at health plans is just to get to know your provider representative by name. That's really helpful. Sometimes you're dealing with different people with payers, and sometimes if you're a large organization, you might be assigned one particular representative to help you with your account. And so you just always want to try to use their name in your communication at the end of a phone call or at the end of an email. Hey, thanks, Susan. I really appreciate your help, because they talk to so many people every day. Just using a little bit of sugar kind of goes a long way to me. What you also want to do is just use your skills as a leader to impact the process. So again, when you're dealing with communication, just make sure that you keep in good communication with them. Sometimes the provider relations representatives, you'll be going back and forth with them via email. And so what you want to do is make sure that you're very prompt in your follow-up, and make sure basically that you stay on their good side. What I like to do if I know that there's going to be a long lead time between the time that the provider representative might email me and when I might have the information ready for them that they're asking for, I'll just say, if I know that it's going to take a while to get the documentation, or if there's a glitch in maybe a license, a hang-up where the license might have a wrong street number, or maybe the name's not spelled correctly on the provider's name, I'll shoot the provider representative back a quick email and just say, hey, I got your email. Thank you so much. I'm working on it, and I'll get back to you, and try to give them a time frame, because otherwise you just don't want to leave them hanging and then wondering when you might be getting back to them. So that's really helpful. Just staying actively connected with them to maintain their relationship. And then also you want to help facilitate the information flow and troubleshoot if there's something that you don't understand, or I mean, a lot of things can come up in provider enrollment that you might not, with one payer, that you might not encounter with other payers. And so you just want to, you can clarify. I mean, I've gone back and forth a number of times with provider reps, and it's actually kind of helpful because it gives you a chance to thank them, and to also, at the end when you're done, ask them if you can connect with them on LinkedIn. And I found that really helpful as well. Of course, with any great process, there comes challenges. And so enrollment challenges that I've seen, I just wanted to share with you a little bit. Some of the enrollment challenges that I've seen have been credentialing applications. They can be lengthy, absolutely. I've seen some very brief, a couple pages, and some of them are 30 or 40 or 50 or 60 pages. Credentialing processes, obviously, and times can vary greatly by payer, as I've mentioned. That's kind of a challenge. Attestations, such as CAQH, and then some payers require attestations. They can be frequent and require tracking. Payer databases not updated to reflect the provider. This is kind of a big one. It can be when you're talking about a new contract, because sometimes payer contracting departments and the network development departments don't communicate very well, and they're different people implementing the payers. The network development people are who implement the provider's information into the system so they can get paid. And sometimes a provider can have a contract in hand and wonder why they're not showing up in the payer system. And so there can be delays in discrepancy because of discrepancies in the databases, which just can take a little working out through each department on your part. Paper applications, for payers that require paper applications, they can require original signatures, which can sometimes be hard to get from providers because providers are very busy, or they might not be in the same building as you are. Another challenge that I've seen is when we're doing an online enrollment, sometimes failed login attempts can lock the user out. And so I've had that unfortunately happen with CAQH, PACOS, NPES. Sometimes providers can inadvertently change their password and perhaps not give it to you. So that's one thing that you want to make sure that when you're logging in that you have the correct login credentials. And then the last bullet point, obviously, you can run into some communication restraints with providers. Like I said, they can be very busy, hard to get a hold of. They can be, have different working hours and such. So always just try to, I always try to ask my providers when the best time is to communicate with them. Excuse me. Some more challenges that I've seen is if for information that's missing or out of date or documents or missing, the insurance plan will contact you or the provider. And this can be taken care of just by doing a simple QA of your work. Next bullet point. To avoid delays, it's always best to have all your information current and use the current versions of any applicable paper forms or applications. This is really important. You may have downloaded a paper application for a payer several months ago, and of course, the minute you try to use it, this seems to happen a lot. The payers update their versions of their applications, and then all of a sudden what you've just filled out requires the new completion and a new signature. So make sure that you go, if you're dealing with paper applications, always check their websites to make sure that you're using the current versions. Again, any errors or omissions in an application can delay the health plan members actually accessing services from the provider as well, because that provider wouldn't be necessarily in the system yet. So errors and omissions can actually affect the plan members as well. Enrollment delays and errors and omissions cause payment delays, obviously, and issues for the provider or the organization. So it all boils down to money, money and service, obviously, and we always want to keep those flowing in the best way possible. Next slide, please. And when we don't, we run into roadblocks, obviously. And so the next slide, please, will show us just sort of reiterating some things that can delay payer enrollment. Incomplete training dates that might be entered on your practitioner's applications, inactive state licenses. Sometimes your providers will send you a license and it might have expired last week or a previous day. So really important to try to keep an eye on the fine details of your documentation that you're getting from your providers. Same with the DEA. Make sure always check your insurance, your DEA, your license dates, excuse me, your hospital and membership and privileging. Any type of error, omission in the application information, any supporting documentation, always make sure that it matches up with whatever the payer is asking for. So a lot of times payers will give you a checklist or just list out some bullet points of what they need, and you always want to match it up with what your documents that your provider gives you. If I could advance to the next couple bullets, please. And then also missing documentation that delays payer enrollment. And also lack of response to payers for requests for additional information. This just kind of goes back to the communication flow that you want to keep with your payers, is always be prompt in responding to their requests, but because they usually will come back and ask for information, additional information. Even if you filled out your application completely, payers may have implemented new standards, policies, or guidelines since the application was submitted. So it's always best to be prompt in your responses for additional information. Otherwise, your enrollments can be delayed. So with that, I will turn it back to Donna.
All right, so let's talk about success points. It's really important to kind of recap the things that really make a difference in the effectiveness of enrollment. And as we go through each bullet, I'm going to ask Dina some examples to really hit this fact home. So starting with this first one, beginning that enrollment process immediately upon collecting, and I noticed there's a typo there, but we'll correct that before we send it out to you listeners, but before collecting information. So what Dina and I are suggesting is please do not wait for that medical staff or practitioner to be granted privileges or membership at a facility. collect as much information about that practitioner as possible to satisfy that health plan's requirements. So you're really doing a parallel process as opposed to sequentially. And with that point, may I please ask Dina, can you describe just briefly what are the types of things that would be collected for an application for enrollment?
Absolutely. First of all, most importantly, would be the provider's application. The provider, unless they're in CAQH, some organizations, even if they are in CAQH, some organizations will require the provider to actually fill out an application. Just totally depends on the organization that you're doing the enrollment for. So obviously the first thing would be the provider's application, and then also all of their supporting documentation. Now this is their licensure, their DEA, their malpractice. Some payers require attestation questions. Copies of, some payers will require copies of a practice's lease agreement for the service location that they practice at. Any type of documentation, educational support as far as supporting their education, such as their medical degree, any type of CEUs that they've acquired, those types of documents.
So Dina, the parallel that I'm hearing is really similar to what credential verification professionals do. They would be very familiar with this process in the enrollment application process.
Absolutely.
All right, then and thank you for that. Now let's move on to bullet number 2. Again, this is crucial. Let's not reinvent the wheel. If we're lucky enough right now to have a software, a credentialing software, please contact them to see whether or not they offer an enrollment program or an enrollment product. And then if they do not, then it may be advantageous to do an assessment on whether or not that current software company is really being able to meet your needs. Any comments that you want to make about that aspect, Dina?
Well, I think it's very helpful to speak with, for people who use these products, it might be very helpful to speak with a customer support representative from their vendor, just to make sure that, or maybe, I mean, we're sort of running the gamut on our audience as far as their user ability. So our audience could be depending on their organization, they might go to their supervisor and ask if there's somebody that they could speak with or some training that they could get with their software. Or if their organization is smaller, they might just be able to go directly to the vendor through their help area on their website, and just make sure that they're keeping up to date on the features and benefits of their software. I think that's very helpful, just to make sure that they know everything that their software can do, and ask if they're able to submit applications through the software. That would be very helpful.
All right, then moving on to our next bullet, minimize the use of paper forms whenever possible. Dina, have you ever had, I don't want to say statistics, but do you kind of have a gut feeling about how much longer it takes to process an application for enrollment when you have, when you're just dealing with the paper versus the electronic?
Oh boy, I mean, paper forms are so much more time consuming. I mean, that just goes without saying. As far as payers are concerned, Obviously, it takes less time for an electronic application to go through the payer's website than it does for a paper application to travel to their to a payer's intake department, be uploaded and processed by their analysts. But also, what I've heard is that some payers process them in the same order, so sometimes it doesn't matter if it's paper or online. It really just depends on the payer.
Okay. All right. And I know that as this industry continues to evolve, just like we do in credentialing, we have measurements of how long it takes for an analyst to process an application. This will become sometime down the road, but it is an interesting point, and I bet the next time you have to do a paper one, you'll be thinking of that question. How about the next bullet then? Let's see where we are here. Responding to payer requests as soon as possible. I think that bullet and our last bullet really hits home about the importance of mutual respect. We as the people who are doing the work, we sure need to rely on our stakeholders to provide information, and vice versa. So the more we can keep the practitioner or the provider informed about what the status or the delays are, the better we will all be, because we will be able to turn that activation time around much more quickly, and thereby creating revenue streams. All right, moving on to our next slide then. The enrollment process has been completed. So what are the final steps about enrollment? And it really is this. If enrollment is improved, note that the insurance plan will contact the provider. That provider will then be linked to the group, and again, that insurance plan or health plan will activate that provider. When the approval has been granted or authorized, they will then activate that provider in that registry or in that plan. Now, conversely, if enrollment for whatever reason is denied, and let me pause there and ask Dina, what would be occasion for an application to be denied?
Good question. And this does happen, believe it or not. Providers can be denied for a plan being full of the network plan being full of providers at that time. So the network, some networks allow, or health plans have a network of providers that they only allow a certain number of providers in a geographic area for their specialty. So there are times when providers can be denied due to sufficient network coverage in their area. And I've seen this happen. It happens quite frequently in the ancillary world, such as DMEs.
What does that mean?
Durable medical equipment.
Okay.
So that market is quite saturated in most geographic areas. So it's pretty common to get denied enrollment for DMEs, mostly with commercial payers. But I have seen it as well with some practitioner clients of mine. For their specialty and their area, sometimes enrollments can be denied just because there's sufficient coverage within a health plan's network in a geographic area.
So that's the primary reason, would you say, denial is issued?
Yes, to me, that's the primary issue.
Has anyone been denied that you've worked with because of some red flag on their file?
Oh, well, yes, obviously, yes, that can trigger a denial as well. Okay. Any type of sanction, anything like that. But those types of questions are usually asked during in the provider's attestation area of the application. So it seems they're usually asked to explain, if they So, but that definitely could be a reason. But the most part that I've seen is just that the market is not, the network is not open at that time. And then, yes, and they're asked to reapply in a certain number of months.
Perfect. So that was a wonderful segue. So yes, and every plan establishes what that time frame is should their application be denied, correct?
Yes.
Okay. All right. So that in a nutshell provides to our listeners the definition of enrollment and the various components of what enrollment is, and kind of how the inner workings of it. Now, this isn't the drill down about how to do enrollment. This primarily, this introductory class really was about all of the moving parts and a basic framework of how enrollment works. What I wanted to do in just the last few slides here is again to reinforce the value of MSPs. The more information that we have available to us, the more valuable we will be to our organizations. And just like all of the other competencies that I teach and that I promote truly for MSPs, enrollment has been added to that list of competencies. And enrollment truly can be broken into these 5 areas. You have to understand what the federal and state requirements are. Understand the nuances between the health plans. What resources you need in order to perform the work, focusing on technology, with always our priority being stakeholder satisfaction, your organization, the practitioner, the health plan. And when we effectively manage enrollment, the MSP Value's sense of satisfaction is elevated, and truly we can be that voice of influence to the administration. The next slide, please. It's really the bottom line. The reality, although painful, it really is all about the money. And we as MSPs, we don't receive that disrespectfully, but it's the fact that money makes things happen. And especially in healthcare today, it's going to be so important for us to effectively manage our work so we can truly maximize those dollars for the practitioner as well as the organizations that we work within. And those things alone can be pathways to success for us as MSPs as well as to the medical staff services industry. It's about maximizing revenue. Now, I'd like to close this program with another thought. Your resources are always far greater than you imagine them to be. This webinar proved that. There's lots of information out there. We just need to corral it and present it to our industry. Never ask, can I do enrollment? Ask instead, how can I do enrollment? What else do I need to know about enrollment to consider taking this on? So with that, I'm going to conclude the program with a reminder about, next slide please, the dates for our next sessions. This is where we really do the drill down of enrollment and how it actually, the process works. Please mark those dates on your calendar. Look for the invitations coming your way. And as we gather for the remainder time, I think we have about 5 minutes about any questions that may have come. May I please ask Callie to kind of rotate through the slides so the listeners can kind of jot down contact information regarding Dina and myself. And then I will ask for us to kind of be, Dina and I, to kind of be prepped on what questions are available so we can please respond to our listeners.
Donna. We had a few questions come in, and I wanted to let all of the listeners know that these questions will be available to Donna and Dina after the session. So if we don't get to your question, they'll have a chance to look at them and respond to you if they can. So the first is actually a comment from Tanisha. She says, thank you for acknowledging that the enrollment process is part of the medical staff industry. I've worked on both sides and definitely feel less part of the medical staff world on the enrollment side. So I don't know if you wanted to comment on that in any way, Donna, but it sounded like you have a big fan who is a listener of this.
Well, and I didn't catch her name, but that's exactly what I'm hearing in the industry. Hello, what about us? No one, we need a home. And so I have written a blog, actually, an article for symplr. So kind of be on the lookout for that too. But it very well reinforces the welcome that we, medical staff services, by way of myself, I'll be happy to spearhead it, welcoming the enrollment professionals into under our wing.
The next question is from Ashley, and she asks, what provider types require surety bonds?
I heard you chuckle, Dina.
Okay, I just am waiting. I didn't know if you wanted me to answer that.
You go for it.
Currently that I'm aware of, it would be for DME providers, and that would be DME POS, which is durable medical equipment, prosthetics, orthotics. So that's in my, there may be others, and I can certainly look into it and get back to the, member of the audience and get back to that question. But from my experience, it's mostly with, like I said, DME POS providers.
Great. We have another question from Alette, and she asks, are attestations hospital-based only?
Attestations, are they hospital-based only? No. Different payers can require different types of attestations. Different agencies can require different attestations. It really just depends on the agency.
And I think we have time for one more question, and that's from Dennis, and he asks, do most payers require physical copies of licenses, et cetera, or proof of primary source verifications?
They require, yes. In my experiences, it depends on the payer, in my experiences, and I'm just talking from my experiences. Some payers require an actual physical copy of the license or documentation. Some might take a verification, a printout from a website. If I'm understanding the question correctly, that would be my response, is that it really just depends on the agency. Some require, like I said, some require the actual document, and some require, will accept a verification.
Great. I'll let Donna and Dina close the session out, but from symplr, we wanted to thank you for joining us for the first webcast ever, and this recording will be available later, as will the slides, and we'll email those to you, as well as they'll be posted on our website. So back to you, Dina and Donna.
All right, I just want to close out by saying, as always, I have such respect for what you do and how hard you work. And as I said in the beginning, we're just going to keep at it. And I thank you for your attention. Dina?
Thank you very much, Donna. Thank you to the audience, and thank you